Today's lecture will focus on nutrition during pregnancy and lactation. These are the learning outcomes for this module of the course. Those that are highlighted in blue will be addressed directly through the lecture today, and the other outcomes can be achieved through your textbook and online readings. Of course, the textbook can also be used to enrich and optimize your learning of the other outcomes that are highlighted in blue as well. So nutrition is essential for an optimal healthy pregnancy, as well as during lactation to maximize the nutritional value of the breast milk and health of the mother. It's a very interesting stage of the life cycle because it is associated with the highest nutritional requirements. And you can see in the left-hand side of this screen that there are several vitamins and minerals and macronutrients that are significantly, where their needs are significantly greater during pregnancy, which is in yellow, and during lactation, which is in purple. So throughout the lecture today, we'll highlight several of these vitamins and minerals and macronutrients, for which several actually require supplementation. So optimal nutrition is essential for both the health of the mother and the baby. And pre-pregnancy nutrition, both before pregnancy as well as during pregnancy, is of critical importance due to this concept of fetal programming. And fetal programming is defined as the susceptibility of an individual to chronic disease that begins in utero in response to nutritional exposures. So what this means is that overnutrition or undernutrition can actually influence chronic disease risk. And that overnutrition or undernutrition may be before a woman becomes pregnant as well as during the pregnancy. And what's been shown is that there are nutritional exposures that increase risk of high blood pressure or hypertension, cardiovascular disease risk, diabetes and insulin resistance, as well as obesity during childhood and adulthood. So obtaining optimal nutrition both in the childbearing years and during pregnancy is of critical importance. And just to highlight this importance, as an example, are many of the factors that link to childhood obesity. So there are several factors related to overnutrition that influence childhood obesity as well as undernutrition. Um, so you don't need to memorize this, but it's just an example of all of the ways, physiologic pathways that can influence childhood obesity through maternal perinatal dietary habits. So looking at pre-pregnancy weight status, pre-pregnancy weight status can also greatly influence pregnancy outcomes. When someone has a high pre-pregnancy BMI greater than 25, there are several risks. There are risks for the mother in terms of the development of gestational diabetes, the likelihood of developing preeclampsia or high blood pressure during pregnancy, as well as the need for surgical interventions during delivery, like a C-section, largely because the higher your BMI, the greater likelihood you will have a larger baby. So in terms of increased risk for the baby, there's greater risk of preterm delivery or preterm birth, having a larger baby, as well as increased risk for development of neural tube defects as well as congenital heart defects. So the recommendation is that women try their best to attain a healthy pre-pregnancy body weight prior to becoming pregnant in order to reduce these risks. On the other hand, a low pre-pregnancy BMI, defined as a BMI under 18.5, also increases risks. And these two risks relate to first increased risk for preterm birth, but also a small for gestational age baby, defined as a birth weight less than 2,500 grams. Having a small for gestational age baby or a low birth weight baby in other words, is highly correlated with pre-pregnancy body weight. And it's actually an important predictor for mortality, for infant mortality. So it's a very important outcome that we should try to minimize. And we should try to minimize its occurrence by promoting a healthy pre-pregnancy body weight. And this is particularly relevant for individuals in low and middle income countries where there's a higher proportion of individuals who may have a low pre-pregnancy BMI. So naturally, the recommendation for this group would be to gain weight before becoming pregnant. So moving on to during pregnancy. So during pregnancy, body weight is the best indicator for the health of both the mother and the fetus. And so tracking weight gain during pregnancy is an important clinical activity or indicator. So the weight, as you can see in this figure, the weight of weight gain will vary by trimester. By the second and third trimester, there is more significant growth of the fetus, expansion of the blood volume, and greater growth of the placenta and supporting structures for development of the baby. And you can see with regards to the weight gained where the weight is being gained. So there's an increased fluid volume in the breast. So breast milk is being produced by the end of the third trimester. There's an increase in an expansion of blood volume to the placenta. The weight of the infant, clearly. An increased size of the uterus and the supporting muscles to support the baby, as well as an increase in maternal fat stores, which also add a significant amount of weight. And so when we look at weight gain recommendations, we look at two things. We look at first the rate of weight gain in per week, and we also look at the total amount of weight gain for the pregnancy overall. So when we look at the rate of weight gain in the first trimester, it's recommended that an individual, a mother, consume 2 to 4 pounds throughout the entire trimester. So there's very little weight gain in the first trimester relative to the second and third trimesters. In the second and third trimesters, you can see the recommendations in this table. So there's a recommendation for the rate of weight gain per week and then the rate of weight gain overall. So the rate of weight gain per week is based on pre-pregnancy body mass index, so body size before pregnancy. And those who have a lower BMI will have a recommended higher amount of weight gained throughout the pregnancy. So just to look at this, to illustrate this, a person who has a BMI less than 18.5 is recommended to gain 1 pound per week, and a person with a BMI greater than 30 will be recommended to consume or to achieve a 0.5 pound per week weight gain. So quite different goals. When we look at the recommended weight gain overall, so total weight gain throughout the pregnancy, this is also varies based on pre-pregnancy body weight, with those who have a lower pre-pregnancy weight having a higher total weight gain as compared to those who have a higher pre-pregnancy body weight having a lower overall weight gain. And so not surprisingly, the weight gain recommendations are different for twin pregnancies with an overall greater amount of weight being gained. However, again, this is based on pre-pregnancy BMI. So looking at translating weight gain to energy and food requirements. So one of the most common misconceptions during pregnancy is that a person is eating for two. A mother is eating for two. And so some people actually take great pleasure in being able to eat more food or however much food they want. But in actual fact, we don't need, women don't need that much extra calories during pregnancy. During the first trimester, there's actually no additional energy needed in order to support a weight gain of 2 to 4 pounds. However, it's in the second and third trimester that there's an increase of 340 calories and 450 calories, respectively, um, that that will be needed in order to support weight gain and the growth and development of the baby. And so rather than saying we're eating for two, a more appropriate response would be eating twice as healthy rather than twice as much. So, not necessarily focusing on overall energy and the amount of food, but focusing on achieving the most nutrient dense diet that is possible. And so, what is recommended is that in the second and third trimester, that a woman increase her food intake by 2 to 3 Canada's Food Guide servings per each day. Now, this actually isn't that much. So, if you look at some examples of what 2 to 3 Food Guide servings is, you can see some examples here. So, for example, 1 cup of milk is 1 serving, or a little cup of yogurt, the little prepackaged yogurts would be another serving. So increasing by 2 to 3 servings really isn't that much, and it's should be quite easy to achieve. So moving on to macronutrient requirements during pregnancy. The acceptable macronutrient distribution ranges are those AMDRs, looking at the percentage of energy coming from carbohydrates, fats, and proteins. Doesn't change during pregnancy. So though there's an overall increased energy need, there's actually not a difference in the proportion that should be coming from each macronutrient. However, because energy is higher, it can facilitate um, greater amounts of macronutrients in terms of grams per day. So carbohydrate intakes recommendations increase from 130 grams per day to 175 grams per day at least. So there is an increased need in this regard in order to support fetal brain development and prevent protein sparing. So we don't want protein to be used for energy. We want protein to be used in order to help with fetal growth. Importantly, the source and types of carbohydrates are really important. So to limit consumption of simple sugars or free sugars, and also to increase whole grain consumption and increase fiber consumption. So we know that this group of young women typically don't meet their fiber requirements. However, during pregnancy, it's quite important that fiber requirements are met, particularly soluble fiber, because constipation is very common in pregnancy, particularly in the second and third trimester. So by consuming adequate amounts of fiber intake, an individual can prevent constipation or promote greater bowel regularity. With regards to protein, in the first half of pregnancy, protein requirements do not differ from the general population. However, once the fetus begins to grow more significantly in the second half of pregnancy, protein requirements do increase to approximately 1.1 grams per day. That is the recommendation. We know that most Canadians, including women, consume sufficient amounts of protein in their diet. So this doesn't necessitate a great increase in protein. However, women should be careful that they're continue to consume adequate amounts. The vegetarian people who follow a vegetarian diet may be a subgroup who do have a little more difficulty meeting protein requirements. So extra effort should be taken with this group to ensure that protein needs are being met. And finally, looking at recommendations for dietary fat, the recommendations are the same as in terms of the amount of fat needed as in non-pregnant people. However, there should be a greater emphasis on intake of omega-3 and omega-6 fatty acids, as these fatty acids are essential for brain development in the growing fetus. So moving on to needs for other nutrients like vitamins and minerals. So folate is one of the most important nutrients that should be considered during pregnancy. Folate has many essential functions, such as cell division and formation, and DNA synthesis and amino acid metabolism, all of which are critical in a developing fetus. Um, Inadequate intakes of folate increase risk of neural tube defects. And so this is a very important public health issue, which has resulted in the fortification of food products with folic acid, and a recommendation regarding multivitamin supplementation. So it is recommended that women of who are pregnant or of childbearing age consume a multivitamin of 400 micrograms of folic acid daily. So, relevant, a nutrient that's relevant both in the childbearing years, so people who may become pregnant as well as those who are pregnant. Um, it is also recommended that during pregnancy that women actively consume folate-rich foods in order to ensure that their folate requirements are being met, which we will review in a moment. But along with folate is vitamin B12. Inadequate amounts of folate or vitamin B12 impairs the maturation of red blood cells and can cause macrocytic anemia. So it's really important that intakes of vitamin B12 remain adequate during pregnancy. The main sources for B12 are largely animal products, including milk, meat, and eggs. Vegetarians in particularly may be at risk of vitamin B12 deficiency, and may require supplementation. So that is a particularly vulnerable group who may be at risk of inadequacy and require nutritional intervention. So when we look at folate sources, we can look at those foods that are fortified in folate as well as natural sources. So our natural sources of folate are those, for example, green vegetables and lentils are very rich sources of natural folate. When we look at fortified folate, we know from previous lectures in this course that folate fortification is mandatory in white flour, in cornmeal products, and in pasta. So it's not surprising that these foods, which already make up a large proportion of the calories in a Canadian diet, are actually supplying a very rich source of folate and help individuals achieve adequate folate intakes. So just breaking this down by food group, you can see again that the richest sources of folate are going to be in green vegetables and are going to be as part of lentils and meat alternatives. So moving on to another very important nutrient during pregnancy, which is iron. So iron is a very interesting nutrient in pregnancy and the body's response to the need for iron. So the body actually conserves iron during pregnancy. First, there's an adaptive response. So during pregnancy, menstruation ceases, and so there's reduced iron losses. As well, the GI absorption, gastrointestinal tract absorption of iron doubles to triples. So the body's response to an increased need for iron is to increase absorption. So it becomes much more available. The fetal demands, and this absorption increases mainly because fetal demands are so high that what ends up happening is if there's insufficient amounts of iron in the diet, despite the increased absorption, the fetal demands, the need for iron will actually result in drawing on maternal iron stores. However, even though the fetus will draw on maternal iron stores, inadequate amounts will still not be in the inadequate amounts will still be present in the diet. So supplementation is needed because stores become so depleted, intakes are not sufficient that we need to provide excess in additional iron through supplementation, particularly in the second and third trimester. So, if a woman is consuming a multivitamin throughout her pregnancy, those needs will be met in the first trimester, but will contain sufficient amounts in order to meet the needs um, in the second and third trimester. Related to calcium, a lot of people think that calcium supplements are needed in pregnancy, but they're actually not. Um, it's recommended that DRI and Canada's Food Guide recommendations be achieved in order to meet calcium needs. Now, we know that young women who are of childbearing age are not always meeting their calcium requirements. So it should be emphasized that those 3 servings of milk and milk alternatives be consumed daily. So to really ensure that calcium-rich sources through the diet are being achieved. And so, quick look at prenatal supplements. So, we've talked about folate, and iron that are required, recommended during pregnancy in terms of supplementation. And prenatal vitamin, multivitamin, and mineral supplements will typically contain extra folate and iron, as well as some other nutrients that are relevant or increased requirements are needed during pregnancy. Um, these there's many different varieties of these multivitamin and mineral prenatal supplementations, and most of them have relatively similar formulations. Moving on to recommendations for fish. So fish is a very good alternative to meats as they are lower in saturated fats and are actually a source of EPA and DHA, which are essential for fetal brain development. It's recommended that um, women during pregnancy consume at least 150 grams of cooked fish per week, and this equates to 2 servings per week. It's also recommended that they consume fish with low levels of contaminants, and some of those fish are listed here. In addition to choosing fish with low levels of contaminants, also to vary the types of fish consumed. So, for example, if an individual consumes one type of fish consistently and that fish contains a particular toxin or contaminant, then exposure to that toxin or contaminant will be significantly higher as opposed to if a person were to consume a variety of fish that all of which may have different exposures or very low levels. Some may have very low levels of contaminants, whereas some have high. So by not consuming the same type of fish all of the time, you reduce exposure to any toxins or contaminants that may be in the fish. Some individuals may have questions about the safety of EPA and DHA supplements, particularly if fish is not consumed. Some people don't have a preference for fish and so look to take EPA and DHA supplements for the benefits that they have on fetal brain development. And these supplements are safe at a dose less than 3 grams per day. So the next few slides are going to review some of the hazards in pregnancy as it relates to diet. And the first of those is quite common, you may have heard of it before, is exposure to methyl mercury. So methyl mercury is an organic form of mercury that is present in fish and is toxic to humans, in particularly to the central nervous system. So methyl mercury accumulates in fish, which is acquired from a fish's surroundings. Predatory fish tend to have much higher levels of methyl mercury because they are likely to consume fish that actually also contain methyl mercury. So they're not only containing it from their surroundings, but also from their food itself. And so the recommendation, not surprisingly, is to limit intake of fish that do contain methylmercury, that being fresh and frozen tuna, shark, swordfish, and marlin. And it's recommended that a woman who's pregnant not consume more than 150 grams or two Canada's Food Guide servings of this fish per month. There's also a recommendation to limit intake of albacore tuna. And so that's the tuna that's labeled white tuna on a can. There's white tuna and light tuna. So white tuna is albacore and it does contain higher levels of methylmercury. The light tuna contains tuna that is either skipjack or yellowfin tuna, and the light tuna actually contains low levels of methylmercury. So light tuna is acceptable, but white tuna is not during pregnancy. And so the recommendation is that women restrict consumption or limit consumption of white tuna to no more than 4 Canada Food Guide servings per week. So alcohol in pregnancy, there's actually no safe level and no safe time to drink alcohol. And when an individual is pregnant or when they're planning to become pregnant. So there are actually adverse effects of that alcohol can have on fertility. And ultimately, the significant adverse clinical outcome that can occur is fetal alcohol syndrome, which is identifiable by the features that you see here on the right-hand side of the screen. The physiologic effects of alcohol are reduced oxygen delivery to the fetus, the rate of cell division. Alcohol can also interfere with transport of other nutrients to the fetus. And when a mother consumes alcohol, she's replacing using alcohol in as a replacement for other more healthier food and beverages that could be consumed. So maternal malnutrition may also occur. And as mentioned earlier, preconception alcohol can impact fertility by damaging ovum and sperm. So should be limited to safe levels prior to conception. Considering caffeine during caffeine during pregnancy. So caffeine is permitted during pregnancy and lactation, but it should be limited to less than 300 milligrams per day. So you can see in this table here that the sources of caffeine per 200 milliliters of a beverage. So considering the serving size here is important because many servings of coffee, for example, are much greater than 200 mils. So for many individuals, having one coffee per day would be the absolute maximum that could be consumed. Not in this table is actually the caffeine per 200 milliliters the caffeine per espresso shot. So when we look at one shot of espresso, we're looking at 60 to 65 milligrams of caffeine. So lattes and Americano coffee drinks are much more common and should be also limited. So looking at other considerations for pregnant women, vitamin and mineral megadoses should be avoided. The recommendation is one multivitamin tablet per day. There are some vitamin minerals that are known to have significant effects on pregnancy outcomes. In particular, vitamin A can cause birth defects, but supplementation beyond one multivitamin and mineral per day should be discouraged. Restrictive dieting should also be discouraged. Obviously it can have negative impacts on weight gain and fetal development. Individuals often have questions about sugar substitutes. Sugar substitutes are safe during pregnancy as long as they are used in moderation. So women should be advised to avoid excessive amounts of these sweeteners. So finally, the last hazard I wanted to discuss was listeriosis. So listeriosis is a foodborne illness that increases risk of miscarriage, stillbirth, and infection to the fetus. So significant adverse consequences on the baby. The symptoms of listeriosis are fever, nausea, and vomiting, and it can be diagnosed by a blood test and treated with antibiotics. The major recommendations around listeriosis are focused on prevention. So preventing listeriosis by avoiding particular foods and ensuring that food preparation methods are adequate in order to transmit the bacteria, to reduce transmission of the bacteria. So, for example, the recommendations typically focus on avoiding soft cheeses and unpasteurized dairy, to avoid uncooked or undercooked meat, poultry, and seafood. So all meat, poultry, and seafood should be cooked during pregnancy. To avoid smoked foods like smoked salmon unless it is cooked as part of a cooked dish. To also avoid refrigerated pâtés or meat spreads. These foods can be consumed, but it's recommended that canned products are better and reduce risk of listeriosis as compared to the refrigerated products. Women should also be sure to reheat processed meats and deli meats, and not to consume these cold, as well as to ensure that all fruits and vegetables are thoroughly washed. And all of these recommendations reduce the risk of developing listeriosis. As a point of interest, women who are pregnant are 20 times more likely to develop listeriosis as compared to a non-pregnant women of the same age. So very important to follow these guidelines. So moving on to lactation or breastfeeding. So breastfeeding is obviously encouraged, but there are several nutritional considerations for the mother during breastfeeding to ensure that she is meeting her nutritional requirements. So during breastfeeding overall, there is about a 500 calorie per day increased energy needs, as compared to a non-lactating or non-breastfeeding woman. It's recommended that approximately 330 calories or 300 calories of this extra energy come from extra food, and the remainder come from maternal stores. So as you'll recall, there's a significant amount of adipose tissue that's gained during pregnancy, and during lactation is a time when this adipose tissue can be used to support breastfeeding. So that 330 calories coming from extra food equates to approximately 2 to 3 additional food guide servings per day from any of the food groups. Because there are increased vitamin and mineral needs during lactation, there continues to be an emphasis on focusing on nutrient dense foods, so foods that are high in vitamins and minerals as opposed to calorie dense foods. So to optimize vitamin and mineral consumption. And just to link back to the earlier slide earlier in the lecture, you can see here on the left-hand side what some of those increased calorie and vitamin and mineral needs are through the purple bar. When it comes to nutritional requirements, a maternal diet that is inadequate in nutrients, in vitamins and minerals, the nutritional composition of breast milk is actually maintained. So what happens is that the mother's stores are actually nutrients are drawn from them in order to maintain the quality of breast milk so that the infant is achieving optimal nutrition. A good example of this is calcium. So if a woman is not consuming sufficient amounts of calcium, calcium is actually drawn from the mother's bones, and in order to either during pregnancy support growth of the fetus or during lactation support the nutritional quality of breast milk. So in pregnancy and lactation, it's actually not uncommon to see that a woman has reduced bone mineral density by the end of pregnancy and lactation. This, of course, is not a permanent state. Of reduced bone mineral density is not permanent because the stores are replenished once lactation finishes. And it's like this for many different nutrients, not just calcium. So when the diet is excess in nutrients, there is likely to have increased concentration in breast milk. So again, we would want to avoid excessive intakes of vitamins and minerals during lactation as well. However, it is considered appropriate to continue supplementation with a vitamin and mineral supplement during lactation. Fluid requirements are of relevance to women who are breastfeeding. So, on average, approximately 3/4 of a liter or 750 mils of breast milk is produced per day. And with this is a great need for fluid. So, in women who are breastfeeding, we want to prevent dehydration. And so, promoting optimal fluid intake is also an important nutritional goal in addition to achieving vitamin and mineral requirements. So it's recommended that pregnant breastfeeding women consume plenty of fluids. Approximately up to 13 cups per day may be needed. And one strategy to achieve this or to remind women to continue drinking is that every time every time a baby nurses, the woman should consume a glass of milk or juice or water in order to replenish um, their own fluid stores or to rehydrate themselves. And finally, there are a few other nutritional considerations during lactation. There are some foods that actually appear in the breast milk. And so a woman may need to restrict these foods in order to maintain an optimal flavor of milk, for lack of better words. So, for example, spicy foods, garlic, and onions can that those flavors can appear in breast milk. So if an infant is being fussy, that may be a reason why. So they may need to be limited. Additionally, alcohol during pregnancy should also be avoided. So just like alcohol has the ability to cross the placenta, alcohol also crosses into the breast milk. And this peaks about 1 hour after alcohol is consumed. So it is possible to drink during breastfeeding, but the timing it needs to be planned and considered. So if a woman who is breastfeeding is considering drinking, she should express breast milk beforehand, before she consumes alcohol. So the general guideline is that for every one drink consumed, a woman should not breastfeed for 2 to 3 hours. Of course, they can express breast milk beforehand, which is recommended, and but careful timing and planning should be considered. And finally, just to reiterate the caffeine requirements, as with pregnancy, caffeine intake should be less than 300 milligrams per day. So that concludes this lecture. So just a reminder, or to highlight some of the learning outcomes that we reviewed during this lecture and ones that can be achieved through your readings in the textbook and supplemented with the online material. Thank you.